Welcome back to Long COVID Doctor, an educational series for those of you who are still suffering from long COVID. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, now working in Long COVID Services for 5 years. I post on all the usual podcast channels as well as on YouTube. I hope you find them helpful, and if you do, obviously click subscribe. We want to spread the word. We want to get these educational resources out to as many of you as possible. Thanks for also for all the feedback that you send in, the comments, the suggestions. I do apologize. I'm not able to respond to all those, particularly the queries that you raise. I wish I could give you all that individual time and individual response, but time is too short for me, I'm afraid. But please, still keep them coming, because I do appreciate them, and also it helps me with future postings. My other apology is my usual disclaimer. It is important, obviously, that any advice or treatments that I mention should only be considered after talking to your own doctor. So, this talk is on tinnitus in long COVID. I'll cover the symptoms and the conditions and the treatments and the strategies to help. So here we go. Tinnitus in long COVID. So first and foremost, what is tinnitus? Basically, tinnitus is the perception of sounds in your ears or your head that don't come from an outside source. So what are you experiencing if you've got tinnitus? Basically, you might be hearing ringing or humming sounds, or hissing or whistling, sort of buzzing, or the sound of bells ringing. That is what people are describing to us in our clinics, our long COVID clinics. That those noises could be, continuous, sort of, basically morning to night, throughout the night, when you're awake, obviously. But they may be intermittent, on and off, sort of like pulsatile. They may be sort of like bleeping sounds. So all sorts of different sort of forms of tinnitus, all sorts of different presentations, varying in volume, either low sort of background soft tinnitus noise, or actually extremely loud and intrusive noise. Like I said, it could be happening at any time, either continuous or on and off, happening throughout the day, but also at night. And particularly, actually, it's quite a common presentation, patients complaining of it at night, because obviously there's no background noise to mask the tinnitus that's there all the time, continuously. It could be just, in general, sort of that sort of sound that's in your head all the time, generally, or it could be just occurring in one ear or the other, or both ears. Okay, so it's very variable. There may be associated symptoms with these noises, this tinnitus noise. There may be associated hearing loss, so deafness, maybe one-sided or both-sided. There may be balance problems. There may be sort of head spinning or vertigo. There may be increased noise sensitivity, what we call hyperacusis. So all these different sort of associated symptoms can occur either together or individually, with or without that tinnitus. I think the effect that tinnitus has on people is quite variable. Some people just put up with it and don't not really fussed by it. It's there, and you're just aware of it all the time. But there are other people that actually it becomes quite distressing and upsetting, and sort of has an impact on mental health. Can lead to someone becoming very anxious or stressed. It has an impact. It can have an impact on your family life, on your work life, your social life, certainly. So, what about some general facts about tinnitus? Because, it is something that is not exclusively, to do with long COVID. It is something that is there in the general population anyway. So, like I said, it's in the general population. It's 10% of the population have tinnitus, which is a big number. I had no idea that it was so common as that when I was in general practice, family medicine. The other thing that's really important to take on board is that tinnitus is only extremely rarely associated with or to do with a serious underlying condition. So that, in a way, it gives peace of mind for people, because, this worrying sound that is new to someone can naturally make you wonder whether it's something more serious occurring. I think the other thing to say is that actually, and it's sort of good news really, tinnitus is a condition that usually with time lessens or even disappears. So the brain, the clever old thing, the brain, it learns to block it out. It learns to sort of to stop hearing it, or it turns that nerve pathway off. And so, in a way, like I said, that is good news. The majority of people, and this is what, the population tell us, that the majority of people with time, tinnitus tends to quieten and actually get blocked out. So in general, are there other causes for this common condition? 10% of the population have it, remember. So what the commonest cause? Well, the commonest cause is the fact that it is an age-related condition. So as we get older, tinnitus becomes more common. Okay, so it's a consequence of getting old, like, sort of worn out joints, arthritis, it goes with what happens when we get old. And often with that is, like I said, the associated symptom of deafness. So deafness and age and tinnitus, both age-related conditions, which is annoying and frustrating. The next commonest cause for tinnitus is tinnitus that follows on from a viral infection. Often there may be associated balance problems. I talked about vertigo a minute ago. And there may be associated hearing problems with a viral infection. So, damage from, say, the virus. The virus brings about damage to the hearing nerves. Okay. And so, measles, for example, although now with the MMR vaccine, it's much less common. Well, there's been a resurgence of it because of vaccine hesitation, but measles is less common, so is less common cause for hearing loss. But certainly influenza, so your common flu, can lead to hearing loss because of damage of those hearing nerves. Even herpes viruses, so Epstein-Barr virus or shingles virus, can cause hearing loss. But, it's not that common, but these are certainly documented cases of tinnitus as a result of a viral infection. Obviously, I'll come on to, tinnitus in long COVID, but obviously we know that, we all know that long COVID has come as a consequence of a viral infection, the SARS-CoV-2, the coronavirus infection. So then, it's not because tinnitus comes from other viruses, it's not really that surprising that actually the SARS-CoV-2 virus has caused tinnitus as well. Just before I move on, there are, from other causes, back to other causes, well, there are some really rare causes of tinnitus, such as otosclerosis and Meniere's disease and multiple sclerosis. It can present with tinnitus, acoustic neuroma, jaw joint problems, temporomandibular joint dysfunction. These are all really rare causes of tinnitus, but I just had to mention them, just so that we're aware. So, what actually happens when we think of now switching and focusing on what we're really in the business for, and that is long COVID tinnitus. Okay, so what happens? Like I said, viruses, any other those other viruses, influenza virus, Epstein-Barr virus, the herpes viruses can cause it. But when we're focusing on the SARS-CoV-2 virus, what do we understand about how that happens? What actually happens? So the virus, basically, this is the process. This is the mechanism for SARS-CoV-2 causing tinnitus. The virus gets into the hearing apparatus in the inner ear. You probably know, just a quick sort of update here if you don't, upskill update. Sort of, you've got the outer ear, that is the ear roll and the earlobe, and then you've got the middle ear, that's where those three bones are that connects with the eustachian tube, the back of the throat. And then you've got the inner ear. Inner ear is where you've got the cochlea and the semicircular canals and the hearing nerves, the neurology, the nerves that connect those organs with the hearing center in the brain. So the virus can damage the inner ear, either those organs of hearing, cochlea and the semicircular canals, or the actual nerve that leads from there to the hearing part of the brain. The virus gets in there. The virus can get in there either from the middle ear, okay, the space where the three bones are, and then it can pass from the middle ear into the inner ear, or the virus can get from the brain lymphatics, the lymphatic system in the brain, to the hearing center, or it can actually go in the bloodstream to via a little tiny artery called the labyrinthine artery that goes into the bony labyrinth where the hearing organs are. Not only virus can get into those areas, but also the inflammatory mediators, the cytokines, can get into that area. And so we all know about the cytokines, but also not only the cytokines, but also what we call the brain's innate immune system. So the macrophages and the monocytes that basically bring about tackling the viral infection can get into that area as well. So that area, that really delicate area that is responsible for hearing and balance, can be attacked by all of those ways, by all of those routes. And research studies have shown that SARS-CoV-2 damage, there's damage of those audio vestibular nerves, there's damage of the cochlear hairs in the cochlea that's leading to deafness, and damage of the vestibular hairs in the semicircular canals that leads to balance problems. So those are the causes of, if you like, the sort of looking at the anatomy and the feasibility of the SARS-CoV-2 virus attacking the areas that are responsible for tinnitus and hearing and balance. But like I said, it's all to do with the mechanisms behind long COVID itself. So there's the inflammation. I talked about the cytokines. I talked about the macrophages. Then there's the autoimmune problems that come as a result of dysfunctional adaptive immune system, consequence of the SARS-CoV-2 virus infection. Then there's what comes with the excessive inflammation is the blood clots, the mini blood clots. They can then go to those areas and cause their damage. And likewise, dear old mast cell activation, MCAS. Again, we're very familiar with this. Listen to the podcast on that, just to upskill and to refresh your memory about mast cell activation. There are lots of mast cells in the brain, particularly around the limbic system, around the brain ventricles. But they can be activated and then sending all their inflammatory mediators into the brain. But they'll concentrate, yes, also in the hearing apparatus. I think the other thing to say is, with all those that list of all those long COVID mechanisms, don't forget the other big feature of long COVID is dysautonomia, dysfunction of the autonomic nervous system. So we know this is, again, listen to the podcast on dysautonomia. I've recently posted an update on dysautonomia, the most up-to-date knowledge and strategies to deal with it on dysautonomia. We know that dysautonomia is an integral feature of long COVID. So, tinnitus, when someone complains of tinnitus, I automatically start tuning in. I wonder if there are other dysautonomic features, such as faintness or palpitations or temperature dysregulation, that chilly feeling, or temperature dysregulation of going hot and cold, and nausea, and pain sensitivity. These are all, as you know, common features of dysautonomia, and tinnitus is common with it. Often looking at it from the other sort of angle, when I've got a patient who has classic, typical dysautonomia when they're coming for their palpitations or whatever, etc., in the assessment, often they say, oh, the other thing I've got is, besides my temperature regulation, I've got this terrible tinnitus ever since I've had long COVID. So it all goes together. It's all part of the package, I'm afraid, of long COVID dysautonomia, long COVID in general. So there we are. That's a long explanation of what tinnitus is and how it's come about, and in particular, specifically, tinnitus in long COVID. And why is it important to know all this? It's important to know all this because we know, therefore, what we're dealing with. And, understanding the causes actually brings peace of mind, and it helps us with the validation. These causes are real. They're not imagined. It's not all in the head. And it helps with acceptance, and understanding brings peace of mind and acceptance. So that's why I think it's really important. And often in these postings, I do talk a lot about the causes, because it's so important as part of your understanding of long COVID and hence acceptance, etc. So what should we do? If you have a new symptom, of course, you've got to take it to a doctor, haven't you? You've got to take it to your GP, your family doctor. Report anything new, because safety first. We don't want to be COVID blind, all because you've got your new symptom and you have long COVID. You can't necessarily say that they are linked. They may be just coincidental, and your new symptom may actually be something completely unrelated to your long COVID, and actually maybe something serious. So off to your GP, report the symptoms. We've got to get the diagnosis and to rule out those, and I say they're rare, they're really rare causes here of that tinnitus. So off to your GP, and what will happen? Basically, the GP will hear the story, hear your symptoms, and then ask all the other other background history, how long it's been there, what makes your symptom better, what makes your symptom worse, and weave into it, any past medical history, any medication you may be on, etc. Following the history, then, is, as always, the examination. And obviously, because it's tinnitus, it's to do with the hearing, with the ears, etc., it's all in the head, the GP will probably be focusing in more on the ear, nose, and throat aspects of your condition and sort of adapt the examination more to the ear, nose, and throat, but also neurology. So that the neurological side he or she will look into. Then it's usually investigations next, isn't it? But actually, there's not a lot that in GP land we would request other than standard blood tests, which you'd probably have done anyway because you've got long COVID, looking for, their full blood picture, your liver function test, your kidney function test, your thyroid, inflammatory markers, etc. So, standard routine blood tests. And then part of the whole GP process is obviously looking for red flags. Red flags, those symptoms or signs that are more suggestive of other more worrying conditions. So red flags in tinnitus, well, again, there aren't really very many, but obviously, we're focusing on neurology. So any neurological symptoms and signs that, suggest a stroke, you'd send the patient off to a stroke specialist straight away. One-sided ringing in the ears that's really persistent, really troublesome, or pulsatile tinnitus, pulsation tinnitus, as in your pulse, you can hear your pulse in your head, that's obviously concerning. You want to take that to your doctor, and the doctor will probably want to request extra tests via a specialist, a hospital specialist. Sudden onset, complete hearing loss. Again, that's worrying, isn't it? So you'd want to be taking that to your doctor, your GP, who would then, I'm sure, send you off to the ear, nose, and throat specialist straight away. Likewise, complete, really debilitating, uncontrolled head spinning, vertigo. Again, you're going to be wanting to report that to the doctor. The doctor will probably want to send you to neurology or ear, nose, and throat. Having said all that, I said it already, actually. Red flags, those symptoms are pretty rare. But, obviously, nevertheless, we don't want to overlook them. We don't want to be COVID blind. Remember, safety first. So, how are we going to manage tinnitus? Remember that, as I said earlier, most cases improve or clear with time. Hold on to that. The brain's a clever old thing. It learns to blank those noises out, that tinnitus noise out. This is the process known as habituation. So that's a natural process. The annoying thing is that you can't put a time frame on this. It's impossible to know how long it takes for habituation to take place, but it does the vast, vast majority of cases. I think the vast majority of patients actually are greatly helped and reassured and comforted by sort of simple explanation and reassurance in, what tinnitus is, etc. The vast majority will not need to go off to the ear, nose, and throat specialist or a neurologist. Often, like I said, reassurance and a simple explanation is all that is needed to help sort of cope with, deal with, understand, and accept tinnitus. However, there are, things that you can do to try and help deal with it whilst you have it before it goes away naturally with that habituation. So how can you help? How can we help, deal with it, cope with it? So there are masking devices. So to bring about background sound. What's the whole purpose of that? Really, to actually blank out the that to distract, if you like, so that it masks that annoying ringing or buzzing or whatever it sounds like. So like I said, tinnitus is more troublesome at night because in the dead of night it's quiet, isn't it? And so it's therefore tinnitus is more intrusive because it's there. There's nothing to mask it, nothing to blank it out. So you can mask it by, you can get these little mini speakers that you slide under your pillow, and it sort of it puts out a sort of either a natural sound, waves or trickling, or some people even use sort of their favorite relaxing playlist for relaxing music, just to sort of blank out that noise and so extinguish the tinnitus. Some people put on a boring audio book, and the sound of the spoken word gets them off to sleep and sort of masks the tinnitus nicely. White noise machines, or better still, you can just use your mobile phone and get onto your whatever app you use for music and look up white noise. So that will just sort of just give you that sort of white noise sound through the night. Again, a nice little mask. If you've got tinnitus, you may well have done what most people do when they've got anything, and that is to Google how to treat tinnitus. Well, hopefully, masking devices and those sort of suggestions really is what came up top of the list of suggestions. Just to say that there are a number of unhelpful treatments. Well, unhelpful in the sense of not evidence-based. So, if you look up, how to deal with tinnitus on less reliable sites, you may see a list of things like antidepressants or anticonvulsants or anti-vertigo drugs or ginkgo, thinking supplements now, ginkgo or zinc or melatonin. They help with they say that they help with tinnitus, but studies have done with all those, and they've not shown any evidence that they help. Okay. The other one that might come up is neuromodulation therapies. Sounds impressive, doesn't it? Anything with neuro on it makes you think, oh, this is serious. This is must work. And it's all and then they sold on, lines like, this is, it helps normalize your neural activity of the auditory system. It's tinnitus training or retraining, sorry. Sort of, it reprograms the nerves that serve the hearing apparatus. And it means these sort of neuromodulatory therapies are all to do with, putting these, say, electrodes or electrical, sensors or magnetic energy or auditory things, wearing like headphones or what have you, on the head or the neck. But nice guidelines. So guidelines here in the UK. So the National Institute of Clinical Health Excellence basically has looked into these, and actually their comment is that we do not recommend these for tinnitus. So that's not what I've said, it's what NICE have said. So these companies that sell them can't have a go at me. I'm just saying what the NICE guidelines say. A reliable resource for tinnitus is the British Tinnitus Association. So go online, tinnitus.org.uk. So this is a trustworthy resource. It offers free support and resources. So Google them, British Tinnitus Association. So what can we expect with long COVID tinnitus? I'll say it again, basically gradual improvement with time. This is the experience in general for tinnitus, this common condition. Remember, 10% of the population have it. So this is the experience across the population, but it's also the experience within our long COVID population. We need time. We need time for the brain to blank out that annoying noise, those buzzers, those bells, those whistles. The brain will sooner or later, the process of habituation, remember the word habituation, sooner or later blocks out those noises, but with time. But also we need time, don't we, for long COVID mechanisms to settle, the causes behind long COVID to settle. So remember the causes? So that excessive inflammation. With time, it calms with time. Inflammation, long COVID, calms with time. Autoantibodies, again, they clear with time as the inflammation settles. Those damaged nerves, the nerves that have been damaged by the acute COVID infection and just taking a heck of a long time to heal, will regrow. The process of neuroplasticity, so nerves in the brain and peripherally, nerves in the brain firing together, wiring together. This happens with time. And those little blood clots, those microthrombi that basically go and block the blood supply and oxygen to tissues, be it to nerves, be it anywhere in the body, those thrombi take time to be cleared. So those blood vessels are recanalized. Sooner or later, those clots will be dissolved. If they're not dissolved, the blood vessels, if you like, sprout other little blood vessels and cause neoangiogenesis, so new blood vessel formation to bypass those little blockages, those blood clot blockages. So again, that takes time. It all takes time. Mast cell activation, again, another one of the underlying causes of long COVID. We're familiar with this. Mast cell activation, again, will settle with time as inflammation settles, but we can speed that up, can't we? By taking H1 and H2 blockers, histamine 1, histamine 2 blockers. Listen to the MCAS podcast, like I said earlier. Dysautonomia, again, hopefully settles with time when all these other processes that drive long COVID settle. But like I said, most patients, and most of our long COVID patients, tell us that, tinnitus settles over months or, over one or a couple of years. Yes. How are we going to speed that process up? Well, speed up the process of recovery from tinnitus. Well, how are we going to speed it up? Basically, there's no specific treatment for the treatment of tinnitus. Like I keep saying, it's to do with time. But tinnitus will settle as long COVID settles. So how are we going to speed up long COVID recovery? How are we going to do that? Because after all, what do we want to, what is long COVID recovery look like? How are we going to achieve that? Basically, we need cellular repair. Those damaged or dysfunctional cells need to be repaired, replaced, replenished, repaired. We need inflammation to settle. we need the systems of the whole body, the neurological system, the cardiovascular, respiratory, liver, the immunological system, the blood-forming system, all to be working together in harmony again, rebalancing that state of what we call, that fancy medical word called homeostasis. That's what we need to get back to. That's basically body equilibrium. Equilibrium of all the systems working in harmony together. Balance, harmony, homeostasis. When this is achieved, dysautonomia will settle. And remember, dysautonomia, tinnitus is a common feature in dysautonomia. Again, back to that fundamental question: how, for long COVID recovery, how are we going to bring that about? I think, well, remember the bigger picture here. The bigger picture of long COVID recovery. The bigger picture is basically energy management. We've got to manage our energy most effectively. So remember, again, fatigue management. We've got the planning, the prioritizing, the pacing, planning our day, planning our activities, prioritizing, tasks. As a task you do need to do, or can it be delayed? Can it be delegated? Can it be dumped, deleted, binned? And then pacing, dear old pacing, smaller chunks, small incremental increases, pacing. So that's all to do with energy management. So important for your overall long COVID recovery. And then there's gentle reconditioning, those muscles that have been underused, those tendons that have tightened up, those ligaments that have tightened up, gentle reconditioning, stretching, getting the flexibility back into it, getting the sort of the stretchiness, and of those tissues back again. So yoga, for example, will help with that gentle reconditioning. And then there's diet, so important for long COVID recovery. Why? Because diet, a mixed balanced diet, say the Mediterranean diet, will bring you all those necessary components of the building blocks to replace and renew those cells that have been either damaged or killed off. And then, a mixed balanced diet will give you those polyphenols, those antioxidants, anti-inflammatories. And also a mixed balanced diet will give you the prebiotic fiber to nourish your microbiota. So important. The microbiota is so important for immune support and production of neurotransmitters and vitamins and the gut-brain axis. And then there's de-stress, so stress is not good, and it sort of interferes with natural healing. So, why not try some mindfulness to get that focus on now? And then social connection, that's really important for sort of the overall general recovery, because as Aristotle, the philosopher, said, man by nature is a social animal, and we know that social interaction, connection, brings you a longer life and a healthier life. It's not only lifespan, but it's also health span. So remember all those other ways that we go about tackling long COVID. So there we are. Tinnitus, the update on tinnitus. I've said it all. There we go. I hope you found it really helpful. And as I said, this is an educational series for you long COVID sufferers. This is a trusted resource for you. Remember though, my usual disclaimer, any advice or treatments that I've mentioned, discuss with your doctor. And, remember, safety, always safety first. So, I hope you found that helpful. So if you have, obviously click subscribe. As I say in YouTube, it's a bit of a cliche, but yeah, click subscribe. Why? Because I want to get this out to as many of you as possible. I'm not benefiting from this. There's no advertisements. There's no monetization. I just want to get this out to you. That's going to be my reward, to educate as many of you as possible. Let's spread the word, share. Let's share these. Thanks for your feedback. Like I said, apologies, just haven't got time to respond to you all, but keep them coming. They help me. Thank you. So there we are. In the meantime, I wish you all well with your recovery from long COVID. So all the very best to you all, and cheerio. Bye.